delighted to say that I'm joined by Professor Richard Harvey. Thank you so much for your time. You've just come off the back of your very busy session. Standing room only, I understand.
Yeah, it was very busy, Miranda. Thanks.
Tell me a little bit about some of the clues that would lead a pharmacist to suspect a child would be suffering an allergy rather than just your cold bacteria infection.
You know, I think a lot of parents are pretty clued up on the full-blown allergic child.
Okay.
So this would be a child with classic hay fever, red watery eyes, itchy sneezy nose. They react to dusty environments or animals. I don't think we really need to educate pharmacists or parents in identifying that child. I think the real target group here are children, though, that present as if they're having recurrent sinus events, or every simple viral event turns into a really prolonged period of congestion and green mucus. And I think many doctors, especially general practitioners, assume, along with the parents, that maybe the child's had some sort of infection. But what's really happening here is the child has a low-grade or subclinical allergy, and they're just going through the normal viral events on top of that. I think the sort of children that we need to identify allergy with or go on and have other treatments, you would look at patients who have prolonged periods of mucus secretion. They're often seeking out antibiotic treatment without necessarily there being a change in the pattern of what's happening. To maybe really very few children should ever be given antibiotics systemically during their childhood, and I think that pharmacists should be on the lookout for children that are constantly coming in requiring antibiotic treatment. There's probably a hallmark that there's something else going on, and there's probably in that group, it won't be everyone, there'll be a high proportion of children with sort of underlying allergy.
That makes sense. What are your top tips for managing allergic rhinitis in a child?
I think a really important thing is identifying it, as we've discussed, that not all kids are going to present as the full-blown hay fever. Most of them will present with episodic events that seem to be much worsened by simple viral infections. I think most parents need to get on board with what is being achieved with treatment. What is being achieved is really just making a patient comfortable during what is otherwise a normal process of the developing immune system. So this means just modulating symptoms, reducing mucus secretion, maybe aspirating secretions, reducing the amount of congestion in the nose. And this is what all the treatment should be doing, because they're the sort of things that are going to turn into better feeding, better sleep for kids, and sort of less parental concern. And I think what we need to move away from is systemic treatments. So local treatments, even things like intranasal corticosteroids, are real local therapy with very little systemic absorption, very little concern about what happens to the rest of the body, but a great way of managing inflammation of the nose. Where treatments like systemic antibiotics are really things that are doing significant damage to developing immune system, especially in children in that critical phase between the ages, say, 2 and 5, when their immune system's developing.